Dr. Bensianoff, we talked about missing teeth, and actually you mentioned that missing teeth can, literally cause, never mind that one or two missing teeth can make more missing teeth falling out, can create gum disease, can get, bone loss, which again makes more teeth missing, but also they rearrange the mouth and teeth start looking ugly even in front, and because the mouth gets rearranged and what you call DMJ, the hinges I call them in your mouth, they get misaligned, and you can even get muscle, aches, neck pain, shoulder pain, headaches. So that's a pretty big thing. Now, tell us a couple, 2-3 ways, or the 2 or 3 ways, which missing teeth can be replaced. What is kind of like the golden standard today, and what are the other standards? Did dentistry improve there over the last, decade or so, or has it stood still since the invention of fire?
Well, of course, we've had tremendous improvements in dentistry, and let's say 20, 30 years ago, once you had a missing tooth, you were pretty much limited to 2 options, which were either a denture, something that comes in and out of the mouth, and you put it in a cup overnight, or a bridge, where you would have to, let's say there's a missing tooth, you have to shave the tooth down behind it and the tooth in front of it, and it's like 3 crowns connected together. That's the advantage of this versus the denture is it doesn't come out. These days we have implants, which is a great option for the patients. Implants versus the success rate for implants is about 95%. Versus, and if they're done properly, they can last you 20-25 years. Versus an average lifetime of a bridge, according to American Dental Association, is about 5 years. Also, you get this bad odor in your mouth, which comes from bridges because it's kind of difficult to clean under the bridge. It gets very cumbersome and complicated. Also, there's a chance of losing those teeth that are holding the bridge because they might end up needing root canals, and eventually we might lose those teeth. Versus when we place an implant, we don't have to touch any other teeth. It just implant is like a root portion of the tooth, and the major advantage is it lasts a really long time. The success rate is really high, and you don't have to touch your teeth that are right next to the implant. You don't have to shave them down anymore.
So basically, one of the biggest thing I got out here is, and that seems to be enormous, an implant can last 20, 25 some years, which for many people might be a whole lifetime. And of course I've heard bridges lasting that long also, and we're talking averages here. So even if an implant might potentially be a little bit more expensive at the beginning, for the fact that you might have to replace it 2-3 times till, in the same time when an implant still lasts, that must make a huge difference in price on the long run. Never mind that you have to go to a dentist, which we love you guys when you get rid of our toothaches, but that doesn't mean we love necessarily to go to you. It's just, you happen to have that type of profession, you know what I mean? So who wants to basically spend more time and more money in sitting in a dental chair? So that's major. That's major. On a long run, maybe a little bit more. On a short run, maybe a little more expensive. On a long run, tremendously cheaper. Is that what you're saying?
Well, honestly, the prices for implants versus the bridge are pretty much the same. Maybe there's a little difference. You're absolutely right. They might be a little bit more expensive, but as you said it, and I said it, in the long run, it comes out to be a lot cheaper, and it's more, people think because we place something inside of the jaw, it's very invasive and it's very painful. It's absolutely not. And it's more, I would call it a more conservative treatment versus shaving down healthy teeth.
Okay, right. So actually, this treatment is much more conservative, because when you shave down healthy teeth, it's like with a tree, right? And when we were kids, we carved in something, whatever that was, I love you, Susie. And some trees can stand that. A little carving kills them. Some live. So anytime you shave down and cut down and grind down a tooth, the shock of it might a few years later kill it. Now you have to fix that tooth also, which before was perfectly healthy. That's what you're saying, right?
That is correct.
Okay.